Hey everyone, welcome back. I'm Zen from Society and Us. So today's episode would be on cornea transplant. We are with Dr. Swapnali over here.
Hello, I'm Dr. Swapnali Sabha Pandit. I am the HOD and Director of the Institute of Ophthalmic Sciences in AIG Hospital, Gachibowli. I am basically a corneal and anterior segment specialist. So I do LASIKs, I do corneal transplant, other corneal surgeries, cataracts, and any other surgery involving the eye surface and the anterior segment.
So let's start simple. What is a cornea and what is its role in our vision?
Okay, so I'll show in this model. So the front part of the eye, the black portion which we see, that is called the cornea. Now it is actually transparent. So if you open the eye, this is how the cornea looks like, a piece of glass. It is round and very smooth.
What kind of problems can damage the cornea for a transplant?
So since it is the best entry point of the light to see in the eyes, any scratch on the cornea can cause a problem in the vision. So cornea is something like a mirror or something like the opticals of a camera. So if any scratch or any damage happens in that, that can damage the vision of the patient.
So what are the symptoms of your cornea getting affected?
Most important symptom is the vision getting blurred. After that, sometimes because of scratches, there might be severe pain in the eyes, there might be redness in the eyes, water dripping from the eyes, there might be infection, multiple things. But the basic thing is that the vision gets disturbed.
Okay, now let's go talk about the actual surgery. How does the cornea transplant work step by step?
Okay, so again, let me show here. So in a corneal transplant, since this cornea is getting affected, we replace this cornea with a donor cornea. We make a disc like round opening, remove this cornea which is damaged, take a similar round disc from the donated cornea, put it back and stitch it. Now that is the traditional full thickness corneal transplant. There 16 stitches are placed in a round manner so that this can hold the donor cornea.
Where do the donor cornea come from and what is its process like?
Okay, so donor cornea comes from a fellow human being like us. So when a person dies, within the first 6 hours, the cornea has to be donated. Eye bank people will go, retrieve the cornea from the dead person, store it, and then give it to the surgeon to do the surgery.
Is the surgery done under local anesthesia or general anesthesia?
It can be both. So if it is a simple corneal transplant where the patient doesn't have any other comorbidities or it's a clean surgery, then we do under local anesthesia. Sometimes if it is a traumatic case, a badly infected case, or we need a large transplant, then we have to go under general anesthesia.
Are there any different types of corneal transplant?
Yes. So again, I'll show here. So this cornea has 5 layers actually, though it looks like a compact thing. These 5 layers, traditional, which we call penetrating keratoplasty, means all 5 layers are penetrated. There we make a full cut, through and through, remove the cornea, put the donor cornea back and put the 16 stitches which I told. Nowadays we have advanced technique where we can remove it layer by layer. So sometimes when only the front part is involved, we can remove the front part, keeping the back 2 layers intact. That is called anterior lamellar keratoplasty. And sometimes if the back layer is involved, we can remove that, keeping the front layer intact. That is called DSEK, decimum stripping endothelial keratoplasty.
So now as we know the process of cornea transplant, so how long does it take from someone to see again?
So that again depends on the initial pathology. If it's a clean case where there is no inflammation in the eye, the infection is not there, healthy patient, then within 1 month the vision comes, and then slowly over time as the improvement keeps on happening, the patient sees better and better. But in cases where it is a traumatic case, it's an emergency surgery, there is a hole in the eye, there is a bad infection, sometimes it can take 3 to 4 months for the best vision to come.
So how does a recovery journey look like? Like a general view of it.
Of the recovery. So basically, post the corneal transplant, eye drops are given to the patient, and the patient is kept under very close monitoring. So if there is any redness, pain, irritation in the eyes or blurring of vision, then we have to see the patient and treat accordingly to prevent any rejection. For a corneal transplant, like any transplant in the body, we have to remember that it is somebody else's body tissue which has been put in the patient's eye. So the patient's own immune system will try to reject it. So it can bring in a lot of inflammation in the eye, trying to make the cornea become white again, opaque and white. To prevent that, the monitoring has to be very intense, at least for the first 1 to 2 years. After that, it can be gradually tapered down. But with proper treatment and proper monitoring, many patients do very well with corneal transplant.
Sure. So what are the risks or complications that people should be aware of?
The biggest risk is the risk of rejection, which we discussed just now. So, if the cornea gets rejected, it is very difficult to get it back into its pristine condition again. The second risk is that there should not be any injury to the eye because that can induce a rejection. There should be hygiene maintained, risk of infection has to be removed, and the patient has to be very compliant with both the treatment and the follow up. The patient needs to remember this tissue is someone else's tissue. The patient's body can reject it anytime.
So could you share a memorable patient story that stayed with you?
So I had this patient when I was in the last few days of my fellowship in LV Prasad Eye Institute, Hyderabad. The patient came with a huge corneal ulcer, like the ulcer was from end to end. The entire cornea was yellow with pus. So I had to operate that patient in emergency condition late night, around 11:30, 12 o'clock we were operating. And I put a huge graft. It was not the cornea itself, like from the white area to the white area, I made a huge graft. And I had to put 24 stitches instead of 16 because otherwise the graft wouldn't have held. The lady luckily was very particular with her treatment, with her follow-up, stitch removal, timings, everything. And then I finished my fellowship and I came out. After 1 or 2 years, one of my juniors said that that patient still has 6 by 6, that is perfect vision without glasses. So sometimes I feel it's a miracle because such large grafts don't survive usually, that too in such a badly infected case. So it's a miracle, it's a commitment from the patient's side also, which it touches my heart even today.
So yeah, I imagine eye care is evolving fast.
Yes.
So what are some advancements happening in this cornea transplant?
So the techniques of transplant are changing. So the optical penetrating transplant, which involves all the layers, are being done lesser and lesser. We do it only in cases where we do not have any other option. Most of the time, we are going for the half thickness, the lamellar transplant, what I told now, or the anterior lamellar, DSEC, because these have very fast recovery. In fact, in DSEC surgery, which we do in the last layer of the cornea, there are no stitches. It is just disc out, disc in, and we put an air bubble. So the patient's recovery is faster. The chances of getting better vision is faster. So these are the types of different surgeries done. Then along with that, there has been like a lot of research going on about artificial cornea, liquid cornea, bioengineered cornea, multiple things. So there are a lot of exciting things happening, and hopefully in the next 5 to 10 years, maybe the requirement for a donor cornea from a human might not be there.
So are we seeing any success in this artificial or bioengineered cornea?
So artificial and bioengineered corneas are still in the experimental phase. 2027, there is the ending of a bioengineered cornea project in India, and there are some studies happening in Europe and US also. but it has not gone into the last phase of the human trial. So that will be starting from this year. We are hoping that it will be a major success.
So you're basically telling that the technology is being developed right now.
Yes.
Like, what are the chances of that cornea which you're developing in the lab being rejected?
So that is the most pertinent question that the researchers are facing, whether the human body is going to take this cornea or not. Till now, all the animal studies, because they have kind of, desensitized these tissues, these artificial tissues, so that it doesn't react with the human body. Something like what we have cardiac stents. The body doesn't reject, right? They are finding out better and better materials for it, but it is successful in animals. Now we have to go into the phase 4 trial, that is the human experimental trial.
So are there any techniques which can help it for a huge success? Like taking tissues from our own eye and replicating that to make a new cornea?
Yes, so the bioengineered cornea is actually something like that. They are trying to grow the tissues from the stem cells, layer by layer. So if that succeeds, then we in fact do not need even artificial corneas. From the patient's own eye, stem cells can be taken to grow the cornea. So it sounds like science fiction right now, but I am very, very, very hopeful that it will be the fact in the future.
Yeah, so you're basically the own grown stem cell cornea has a lower chance of
Rejection,
rejection.
absolutely.
So how technology improved patients' outcomes in the recent years?
Oh yes, so we have new equipments, investigations coming which can pick up a cornea rejection or some problem in the cornea, the shape of the cornea after the transplant very clearly. There's something called anterior segment OCT. There are different type of topographies. There are multiple equipments which can pick these things up. So it helps the surgeon to understand and treat the conditions better.
Yeah, now moving on. Now, if we see many people in our community don't know about this event, they don't know about
Yes.
cornea transplant. They don't even know that's a thing, and plus, many of them are not willing to donate.
Mm.
So, is there any shortage of cornea donations in India or worldwide?
In India, we are still short of nearly 40 to 50% corneas, which is very sad because we have deaths happening all over the country. It's a huge population. It is basically the awareness and the misinformation. So in India, there is a lot of taboo in multiple places where they do not give the cornea, thinking that if the eye is disfigured, the patient won't go to heaven. So we have had conditions where we have gone and family members have refused and we have come back. So I think a very strong government and NGO push with the correct information is required to overcome that gap.
Yeah,
Same in the world.
yeah, like how the superstitions, like don't walk under a ladder and
Yes,
all.
yes,
Similarly, that
yes,
which is totally false.
yes,
This myths have to also be broken down.
yes,
This myths are breaking down people's lives, preventing them
absolutely.
from seeing.
Yes. And another important thing which many people don't know, I get patients asking me, I want to donate my cornea. How do I write the pledge form? So one thing I always tell them that you have written the pledge form, but your cornea will be donated when you die. You will not be there to tell that give my cornea. And in India, if even one family member puts up an objection that the cornea cannot be given, we cannot take it. So the family members have to be given the information and the correct view that once this person dies, the cornea has to be donated.
So basically, there's a legal loophole that even I, like right now, just register saying that I want to donate my cornea when I die.
Yes.
But then if my wife says
Or
no,
my kids say no,
my wife or kids say no, then it'll
can't
not
give.
be. Even though I've written on my
Yes.
own behalf.
Yes. It is not a mandatory pledge. That is the
So
problem.
basically, what can the government do is make it a mandatory pledge. Once a person signs
Yes.
up,
Yes.
it's over.
Yes. So something like what the government of Singapore does.
Many countries like Spain What they do, they will donate your organs even without your consent, unless you sign a waiver
Yes,
saying that
yes,
I don't want my organs to be
yes,
donated
yes.
after I die.
It's a negative consent, basically.
Yeah, or else they'll harvest your organs like fast,
Yes, yes,
at least healthy
yes.
ones.
And Singapore, if you become a citizen of Singapore, you have to sign that you may give or not give, but if you sign the no pledge that you will not give, in future, if you need, you will not be given any organ for donation. So invariably, everybody signs.
So, are there countries or communities where people don't have access to this surgery?
Yes, there are many parts in our country where, see, basically to have cornea donation, cornea transplant going on, we need a very good eye bank with trained professionals, which is quite less. Thankfully, in the last 10 years, things have picked up well. But even now, there are places in our country where, the corneas go from Hyderabad by flight and then a transplant is done. I think it all depends on the local authorities, the local ophthalmologists, and the awareness process.
Before I close, I want to ask, what do you wish more people understood about eye health?
So I want people to realize that the most sensitive organ in our body is the eye. So if you close your eyes, you will understand its importance, because if we close our eyes, we won't be able to do anything. So maintaining good eye health, doing an annual eye checkup, taking the medications as the doctors say, not rubbing the eyes, not putting anything inside the eye. These are so important, because if a damage happens, it's very difficult to correct for the eye doctor.
What are some tips which you give to the people for maintaining their eye health?
It's a long list, but I'll just summarize it. So, first thing is, please don't rub your eyes. Whatever happens, all infection comes from our fingertips. Second thing is that if we are doing gadget work, we should give rest to our eyes. Our eyes are also organs with muscles, they get fagged out. So, 8 hours, 10 hours of screen time is necessary for our jobs, but we need to give breaks so that the eye rests. And any problem, instead of not consulting a doctor and taking over the counter medications, it's always better to consult and get the eyes saved.
So, what inspired you to become an eye surgeon and what keeps you passionate about it?
So I was very passionate about doing surgery. I like to do things with my hands. And then I found out that eye surgery is the most microsurgery and the most delicate surgery. So it is very, the learning curve is pretty steep, but it is very satisfactory, I would say. When you get, especially when a patient comes and says that I was not able to see, now I can see. So that satisfaction is huge. That is the thing which keeps the drive going in me even today. With new technologies, new surgeries, new research happening, it's a beautiful world which is going to be there out there for eye doctors.
So, thank you so much, Dr. Swapnali, for your time and sharing your valuable knowledge. Your true work truly helps people to see.
Thank you so much.
And thank you for all of you for tuning in and listening to this. You will find a registry donor link in the bio where you can sign up if you want to. Thank you.
Thank you.